You are tuned into the Dr. Tina Show with Dr. Tina Moore. For more, visit drtina.com. Dr. K, thank you so much for coming on the Dr. Tina Show. You came all the way from Miami, so thanks for being here.
Thank you for having me.
Yeah.
It's a trip.
Well, you came thinking you were going to have a vacation, and you stepped into an oven of Arizona. So
It's an oven, but I've never seen so many cacti. So.
Isn't it cool?
Yes.
It's pretty cool out there. So I had to have you on the show because I am in love with your Instagram, and I found you and I was like, this chick is like the same as me. We are into peptides, hormones, regenerative medicine, and basically dropping truth bombs. So I had to get you on the show. We're going to talk about all those things. You always give it straight. So you are a PhD and a PA, and like, how did you get into all this?
Well, I've always been interested in regenerative medicine. I was born with few conditions, and I've always tried to find the reason why inflammation has existed. What happened? What happened to the body? What is the body? What's inside the body? Medicine always interested, but not conventional medicine. Yes, and I came to United States about 23 years ago, and I went into biology, and that's how my career started.
I was a biology major too. So
Yeah.
there you go.
Biopharmaceutical science, and then I did the doctorate in Russia while being here, and a PA.
Oh, wow. Okay. So you are seeing a lot of the same things I'm seeing. We were talking off air, and I think we should just jump right into that. We were talking about, well, you said it so well. You said, I didn't realize how non-compliant people were. And I was like, amen, sister. That's pretty much why I worked my way out of practice. So let's talk about that. What do you mean by that?
Well, when you tell patients what to do, how to do it, when to do it, and you write down the protocol, and, they come back in a month and like, what happened? Nothing really happened. They follow for a week and then they fall off.
Yeah.
Because the life happens. But then I ask the question, well, if the life happens, your inflammation is still happening, nothing changed in that direction, what are we going to do about that? And, if everybody have an excuse, laziness, I call it.
Which is hard to say because I understand now that I'm in the throes of that perimenopause, menopause shift. I do feel the impacts of what waning estrogen does to the body. It definitely makes you want to stop moving.
Absolutely.
There's definitely this decrease. I used to be the girl that was like up and moving, and, I had a lot of that non-exercise, energy coming out of me, and not so much anymore. And I feel for them, but you're correct. I think that laziness, because it's not a lack of knowledge, it's not a lack of direction. And I do understand that there's autoimmune disease and pain, which we'll get into. But yeah, I'm with you. I think
we do provide the directions and the knowledge, and the only job for them is to follow.
Yes.
Yeah.
Yeah. What do you think the hurdle is?
The family, the kids, the husband, the work, the job. I mean, and don't I have that all? I mean, I don't have kids, but right, I have a job and I have many kids. I call them patients, and I have a husband. And I do also have a life, but I do try my best to invest in my future, because I believe exercise is the investment. Eating clean is an investment for your future. Estrogen replacement is an investment for your future, where you're not going to fall and break the neck of your hip bone. I mean, it's all investment for the future. And I like to give this example. For example, before the age of 40, nature takes care of the women's body. But after 40, 45, we have to take care of our body, because estrogen declines, progesterone drops, testosterone drops, everything drops. And now we have to take the responsibility to replace it. But with the replacement, the lifestyle have to follow.
Yes. And I'll add, just as an aside, I see a lot of this online where a lot of these PhDs, I don't know if you're familiar with them, I'm not going to name names, but they don't see patients clinically, but they have strong opinions about women and menopause and maybe whether they need HRT or not. A lot of the messaging is sort of around this, you just need to build more muscle, you need to work harder, which I completely agree with. But I went into this, I'm hoping I'm at the end of perimenopause. I'm hoping I'm right at the cusp. I went into that in the best shape of my life with the most muscle mass. And it wasn't just little bitty weights. I was training for a kettlebell certification. I like Russian kettlebell, strong first, 16 kilo snatches.
Wow.
Like hardcore. I was in incredible shape and I had an incredible amount of muscle mass. And the lack of hormones or the hormones leaving my body still hit me like a freight train. Yeah. And for me, it manifested in just injury after injury, just tissue tear after tissue tear that I couldn't quite get on top of. But I cannot imagine going into it in such abysmal conditioning that so many women are walking into it. They don't have any clue and they are abysmally conditioned. And that, anyway, talk to me about that, because you and I were saying, like, we both have chronic pain. If we don't exercise, we have worse chronic pain.
Right.
This is all part of it.
But again, we have also talked about peptides and menopause, but I want to stress the following. If you don't take care of your estrogen, progesterone, and your exercise, your muscle mass, peptides won't gonna do anything. Honestly, they are the messages. So what are the peptides? They are the messages that your body have to accept. But if your body is busy fighting with a lot of stuff, it's not gonna read the message. It's not gonna accept the message. So I believe that lifestyle should be number one, HRT number two, peptides, we need to talk about that after. But what women do nowadays, they all buy Rera online.
Yep.
Lose a lot of weight, a lot of muscle, a lot of fat, because nobody educate them that they have to eat, they have to exercise. They can't just take GLP-1 and sit on the couch and watch TV after work. They have to actually gain the muscle that to protect their bones. Because losing weight on GLP, if you're not doing it correctly, you can hurt yourself.
Talk about that, because I am very concerned with the fallout that we're going to see in the next 5 years.
Right.
From just mamsy-pamsy GLP-1 use without strength training. Because I have a lot of followers, and what I hear from them very often in mass, which breaks my heart, is, Dr. Tina, I followed your advice and I went on the GLP-1 and it changed my life and I've lost 50 pounds and now I'm going to go to the gym and now I'm going to start strength training.
Oh my goodness.
That is my exact reaction. Let's talk about why.
Listen, every patient that comes to my clinic, and I actually make them guarantee to me that they will exercise, that they will eat their protein, and then I will give them GLPs. And if they say, yes, I do. Again, not everybody is compliant, but listen, I make sure I educate my patient. I give them examples. I show them pictures of anorexia. I show them picture of osteoporosis. I show them pictures of broken hips. And again, I believe exercise is the most important thing, because without the muscle, nothing will, listen, estrogen, progesterone, testosterone, peptides, if you have no muscle, nothing will protect you.
It has nowhere to land.
Exactly.
None of those things have anywhere to land and do their magic. I know, it's crazy. So on the flip side of that, something I see a lot around here, so I live in a pretty nice neighborhood and the local gym is fairly bougie. And I am seeing a plethora of middle-aged women that are my age and older, and they are skin and bones. They are all working literally their butts off. They have no butts. They have no glute muscles. And all they do is dink around with these little tiny dumbbells because they're all trying to get that sinewy, Demi Moore, emaciated look. Mm-hmm. Explain to the audience why that is a terrible idea, particularly at that age.
Well, you do need muscle to protect your bones from osteoporosis, as well as protect when estrogen protects you, because muscles feeds the bones. If there is no muscle, your bones are not being fed, and so you're going to break them. And again, exercise is an investment for your future. That's a quality of life that you want to have after 70.
Yes.
You know, that's the because you can be 70 and with broken hips, with bedridden, or you can be 70 and be still active, go on hikes, travel, and just live the life.
Yes, absolutely. I keep running into musicians that I followed that I was like madly in love, like Rick Springfield. You probably don't know who he is, but when we were little girls, Rick Springfield was like the dream boy, and he was on the soap opera General Hospital, and he was, a musician. And I think many of the girls in my generation, like that was our first tape that we ever bought, was Rick Springfield. And a video was going around of him the other day. He's 76 years old. He's got no shirt on. He's singing from the stage. And yeah, he's had a lot of plastic surgery, but he looked fantastic. Like no shirt, looked so good. And I posted it on my stories, and the DM responses were off the chart. I mean, I got so many views and so many comments. The engagement was crazy. It was all these women that were like, oh my gosh, he's 76 and he's on the cusp of 77. So that's my mom's age, and it's vastly different.
Yeah.
Right. The outcomes. And I'm not trying to throw any shade at my mom, but like it makes a huge difference. And that's very difficult you don't get to that age, end up frail, and then build it. Yes, it's possible you can put some muscle on as you get older for sure, but it's so much harder when you're that far behind the ball, when you've really let it go. And I think that starts in middle age at the latest. Like you really have to get your shit together in middle age at the latest.
And walking is not the thing.
Yes.
I want to stress that too. Because, I walk every day. Oh, really? That's just normal human thing. You gotta walk, but this is not going to build your ass.
Yes.
It's not going to build the muscle around your thighs. It's not going to build anything. You have to you have to do resistance training. Listen, I do Pilates on a reformer that kicks my ass.
Yes.
But again, you have to work. If you cannot do that, you have to work with the weight. You have to go to the gym and work with the available weight.
I think you got to do both. I'm a huge Pilates fan, but I think nothing can take the place of squats and deadlifts at the end of the day. Like we need gravity. We need the ability to create. I think Pilates is brilliant at teaching you how to create tension within your body, which is huge when it comes to injury prevention or avoiding falls or being able to tension your body when you're reaching in the back of like a huge injury I see in my practice a ton is when women are reaching around into the back seat to pull their purse out or putting a suitcase overhead in the airplane, those kinds of things. And I think Pilates teaches your body how to manage that kind of tension.
Also lengthening. Lengthening. Yes, of course. Again, yes, I don't dismiss that you have to do squats, and I do squats.
Yeah, we got to squat.
We got to squat.
We got to build an ass. That's what I keep trying to tell the ladies. I'm like, you have to build a butt. And so I see all these wealthy, very skinny women with fake boobs and no butts and tiny skinny arms and tiny skinny legs. And
they have a hump on their back because it's growing.
They're starting to get a hump and they're skin and bones. Yeah. And I'm like, good luck with that hump is osteoporosis. I'm like, good luck with your hip fracture. And they think they're doing the work because they're in the gym and they think they're crushing it in the gym, but they're just coming out sweaty and skinny. And I'm not trying to throw shade on these ladies either, but like, that is not the way.
No, of course not.
That's not the way to longevity.
You need to have the glutes to hold the hips, to hold the back, the lower back, the legs. I mean, it's the foundation.
Yeah.
The core, the butt, it's a foundation.
Yep. And there's even some data showing that going into older age with a little bit of fat on you is good for longevity,
Yes.
There's the sort of under-eating longevity picture, where you calorically restrict to induce autophagy, but also just having a little bit of extra adipose in case shit happens and you need a little reserve.
And you do need extra adipose because when I put women on estrogen, let's say, and I've noticed if a woman really skinny and I put her on estrogen, the response is different from a woman who have a little bit of fat.
Yes.
So that lady will feel much better. She will absolutely feel much better on estrogen than the lady with no fat, well, very little of fat.
I agree. And then if they have too much adipose, then I don't know how the estrogen's going to go.
Yeah.
Like I don't know what pathway it's going to choose. I don't know. That's kind of a crapshoot. Well, if it's inflamed adipose, I should say, if they're not, not fit and healthy.
Yeah.
Yeah.
Anything above the certain limit becomes an inflammation.
Yep.
Yeah,
let's talk about that because I think that there's, this health at every size concept, and I'm not opposed to it. I just know what I have seen in clinical practice over the past several decades, which is it's not a matter of if, it's a matter of when. And when you're packing excess adipose around, eventually it will go rogue and it will become pro-inflammatory and they will become metabolically compromised. I've watched the switch get blown on, I've had patients that have been with me for decades and all of a sudden they're like, oh, it's happening what I was warning you of 10 years earlier. And I don't think we talk about that enough. I think it's kind of like the wheels start falling off the car in middle age and those adipose cells kind of go rogue.
We're going to get shamed with the body positive.
That's okay.
No, honestly, because too much adipose tissue is pro-inflammatory. Too little is sarcopenia. So we have to find something in between. And the easy solution now is GLP-1s because everywhere you look, online, not online, you can buy GLP-1s and start injecting and hope for the best. And of course, if they lose so much weight, it's still pro-inflammatory.
Yep.
Because that's when sarcopenia comes.
Yep.
So you have to find that middle ground.
And both are inflammatory.
Yes, and inflammation. What creates inflammation? Too little fat, too much fat. The diet, absolutely right. The diet, the alcohol, the smoking. I mean, I don't drink, and I'm a big proponent of no alcohol at all because there's no safe dosage of alcohol. Inflammation is a big thing especially in women after 40.
Was it you that I saw? Somebody was saying that if alcohol was brought to the FDA today, there'd be no way that it would be approved. I think I saw you on an interview talking about that. I've sort of been fangirling on you.
Thank you.
Yeah, talk about that. So alcohol it's a poison, absolutely. I know, but I love it too much. I mean, I love wine, and it hates me. Alcohol absolutely destroys me.
But social convention, it's a social convention. I grew up around alcohol in Russia. Everybody drank.
Probably a lot, right?
Yeah, a lot. And when I was 17, I tried and drink a lot, and I poisoned myself, obviously. And after that, I didn't really drink too much. I never drank too much, and I drank maybe a few times a year. Never never understood the wine. People say that it tastes good. Okay, never. But alcohol is the huge destroyer, especially for the brain. If you look at the chemistry of alcohol, and that's when it converts to, your liver, acetaldehyde, it kills the neurons every nanosecond. And your liver is trying to detox the acetaldehyde from your blood because it knows your brain is dying slowly. So dementia, Alzheimer's, and all the neurodegenerative diseases, you can prevent that by just not drinking.
Yeah. No, absolutely. There's no winning on that one. It's too bad because I love a good glass of wine. It just does not love me anymore. And I used to sit there and listen to my middle-aged patients, the ladies tell me, I can't drink red wine anymore. I get terrible hot flashes. I feel awful. I can't tolerate it.
And the joint pain after. Listen, I did drink. Last time I drank was on my 40th birthday. And I have arthritis.
Yeah.
And after that glass of wine, I had such a painful hip thing. The flare-up was unbelievable. I was like, why? Just not worth it. And then you take ibuprofen for a week, and then your stomach hurts and you can't eat anything.
Yep.
It's a domino effect. No,
you're right. And it wrecks the gut.
Yeah.
And you're right. It wrecks the nervous system.